Go. All right, so we are recording now, just so that everybody is aware. All right, so thank you guys for joining us. Let's go ahead and get started. So welcome to our first virtual event of 2021. As you are likely aware, the Southwest Florida Regional Tech Partnership is going through a rebranding to Southwest Florida Tech. We're about midway through that process, and we've been spending a lot of time during the pandemic looking at how we're going to adjust the organization moving forward and continue to provide as much value as possible to the community here in Southwest Florida. For those of you that, right, presentation moving along here. There you go. So for those of you that don't know me, my name is Alex Allen. I do quite a few different things here. Oh, I'm sorry, I still have other people coming in. Guess we're just going to do things this way. Yeah, so I'm fairly involved with the community here. So I'm the president of Southwest Florida Tech, co-founder of 239, VP of Client Services for Benchmark Cloud Accounting, which is a portfolio company of one of the 239 or of 239 Ventures, and I also am the program director for 239 Labs. All of these organizations, except for one, share the same focus on adding value, connecting technology in Southwest Florida. I want to take a moment and thank all of our corporate members that make all of this possible, particularly those that have stuck with us through this pandemic. It has been a tough time for everyone, so of course we appreciate people sticking with us here. What does Southwest Florida Tech do? Exactly what I just said. Our goal is to connect technology and provide value to the Southwest Florida community. We do that through these types of presentations, annual awards, tech match, different community engagement, hackathons, scholarships, newsletters, all of those types of things. If you're interested in becoming a member, you can become a member as an individual for as little as 20 cents a day. You can also join as a business, as a sponsor or a corporate member, starting at $1,000 annually. If you're interested in any of these things, you can sign up directly on the Legacy website, which is swfrtp.org, which you can link to from southwestfloridatech.org, swfltech.org. Or you can contact us directly, just email info@swfrtp.org, and we will help you out with that. A couple upcoming events. So we are working on a statewide technology career fair with the Tech Council Consortium that we are a part of. We're also starting to plan our 13th annual, hopefully in person, Southwest Florida Tech Awards for the fall of 2021 to give us time to have those in person. As far as upcoming events, next week we have Neil Pennington presenting for us from Energy to Art. So Neil is very well versed in blockchain. He has his own blockchain startup that he's working on, which I'm sure he'll talk through. But where he's going to be focusing in on is the monetization of assets. And so interestingly enough, you may think, oh, we're talking about NFTs and cryptocurrency and digital assets. No, this presentation will touch on that, but we're also touching on how cryptocurrency and blockchain is making it a lot easier to have large transactions with physical assets, whether it's a yacht, whether it's a piece of high-end art, and how it's taking out the middleman in those processes as well. And then the following month in May, we will have Judah Phillips, the founder of Squark AI. So Squark is a no-code machine learning tool. It's a startup, and so he's going to be sharing practical applications for machine learning that you can implement without needing a full development team or even outsourcing any tools. Any team members. So looking forward to that as well. But now I'm very excited to introduce Jeffrey to you. But before we do that, I'm going to play a quick video. So let's move to the next slide here, and this should just go ahead and kick off. Great, so let me pause that. So this video will run around 6 minutes. I'll introduce Jeffrey, and then we will kick off. This video will be a great introduction to Jeffrey's talking points.
If somebody told me a year ago that we would be hitting this milestone, it would have been difficult for me to believe, but I also think that it's something that we prepared for. We've been preparing for something like this for a while, rapid expansion of service delivery through technology, and that's really what we're about, especially in our innovation area, is really focusing on how do we continue to push the envelope forward to provide the best care.
Hey Megan, how are you?
Good, how are you?
Good.
A project of this scale would take 6 months to a year to accomplish under normal circumstances. For Millennium Physician Group, at the start of the pandemic, it took 1 week.
It's a proud moment for myself and the organization to be able to take something so grand and so massive and be able to execute on it so quickly, so cleanly.
In those early days in March, many physicians, both close to home and across the country, began closing their doors, even as health officials directed the public to seek guidance on COVID-19 from their doctors. Millennium's offices, however, remained open, and as safer-at-home orders went into effect, our physicians continued connecting with their patients over our newly deployed telehealth service, MPG Connect, right when they needed us most.
Any other major things that you wanted to communicate today? Otherwise, we'll go over your labs.
We saw the need, we addressed it, and I think it allowed us to really keep with our mission of your connection to a healthier life, by leveraging the technology.
And then I'll see you in 1 week on another telehealth visit. But in the meantime, if anything comes up, just give me a holler.
I think what's great with this technology is that Millennium is always pushed 24/7. We're here for you around the clock 24/7. And now that we've instituted this technology, we really are there for you 24/7.
The last visit I had was fantastic. The patients are definitely welcoming this new way of doing this, and they know that we are doing this to keep them safe, and it's to keep them safe as well as us healthy. And this is, I think, a great way for us to proceed in the future.
That Dr. Waxer on the phone.
Yes, that's the benefit of our platform is that it's always with your provider, whether it's your doctor or your nurse practitioner. We're going to be familiar with you, you're familiar with us. With other platforms, you may get a random provider that's never seen you before and not familiar with your care.
Telehealth, you are talking to him face to face, but you don't have to worry about, other people around or what you might pick up. Or it's much, much easier and a lot more relaxed.
We embrace this, because it's in the best interest of our patients.
We actually started our telehealth initiative back in 2017 because we knew at some point telehealth was going to be, coming down the road. During the last week of March to the first week of April, we started to see a significant decline in in-office visits. And what we did is by telehealth, we actually started to see the telehealth visits ramp up faster than the in-office visits were dropping. And in fact, during the month of April, we actually saw well over 65% of our visits were done via telehealth.
With most of those virtual visits happening in Lee County.
We were able to continue to see our patients, continue to generate the patient revenue from the visits by using telehealth, and really not have that significant decline in visits and revenue and opportunity to care for our patients.
pivoting to care for 500,000 patients on a technology platform built from the cloud down by Millennium's Lee County team.
For our community, it also is an example of how Southwest Florida can bring out a very high technological application very quickly, built in-house, where we're not really relying upon outside vendors to give us that technology component. So it shows the talent we have here in Southwest Florida.
I would like to see you in 6 months, but if you need anything, we're here for you anytime. So please call us. An important aspect of any technology, certainly in telehealth, is when we start forgetting that this is a camera and that there is people around us. We become oblivious of the environment and we start connecting at the human level.
Oh, it's always fun to see you. I always enjoy seeing you so much.
At the end of the day, what we're trying to supplant is something very difficult and different, right? It's the interhuman relationship, right? And that's primarily what it makes us different. The minute that we are believers in this, that makes a believer of the patient.
The future of telehealth from Millennium is definitely here to stay.
It's been great to see you. Remember, we're always here for you.
All right, great. So I'm going to now stop my share, make sure that we have everybody admitted in. Hopefully everybody was able to enjoy that little intro video. So without further ado, I'm going to introduce Mr. Jeffrey Nelson. So Jeffrey is the CIO of Millennium Physician Group, who has over 20 plus years of experience working at senior levels within multiple industries, including healthcare, accounting, manufacturing, technology, and business services. Before joining Millennium in 2009 as a consultant and then part of the executive team in 2012, Jeff has started many successful companies with a focus on process improvement, innovation, emerging tech, and rapid business growth. In his prior executive leadership roles, Jeff has carved out a reputation as an innovator in multiple industries through his entrepreneurial spirit. Jeff has won numerous national awards and recognition for his continual advancement in new and emerging tech, internal process adoption, lean, quality, and KPI management. So I will now give Jeff the ability to share his screen. Let's see here. Oops. And if everyone could please disable your cameras so that we can get Jeff front and center. And again, for anybody that just joined us, if you have questions as we're going through the presentation, we want this to be an interactive session. So please go ahead and add those into the chat box and I will queue those up for Jeff as I see and review them. So please don't hesitate. But Jeff, please, thank you for joining us. We greatly appreciate your time and take it away.
Thanks, Alex. Can you see my screen and hear me okay?
Yes, sir.
Hey, good. All right, well, thank you, everyone. Again, my name is Jeffrey Nelson, as Alex mentioned. And what I wanted to kind of review today is just a few things that we kind of experienced during the beginning of the pandemic and how we kind of leverage technology to really, I think, help Millennium and our patients navigate through that. So we call it Agile with Afterburners or Agility with Afterburners. So get down here. So real quick, a couple things about Millennium. Our mission is connecting the best doctors, service, and quality every patient, every time. And our vision is the best choice of patients, doctors, and care teams. And it's really about your connection to a healthier life. And you'll hear that a lot with Millennium, and that's what we're about, is just creating that connection. And as you heard in the video, that's kind of what we strive to do all the time. So I want to talk to you a little bit about kind of the opportunity with the pandemic and some of the things that we knew that we needed to solve for kind of early on. So, first we saw this coming in mid-March. We actually had a team in our rapid response group that really was taking a look at the data that was coming out, seeing what was going on with the COVID 19 virus. And we started to really see that in mid-March, and as the video stated, around March 16th, we really started jumping into action, really realized that, we needed to figure something out because we had anticipated that it was going to be the way that it turned out. We needed to continue the continuum of care by providing safe and secure healthcare services to our patients. We obviously had to keep our revenue stream going. We also had to provide a sense of calm during the early stages of the pandemic. One of the things that we really learned and I guess really underestimated was the power of the doctor-patient relationship, right? I mean, people were scared, they were concerned, they were confused, they didn't know what was going on. And so we really wanted to leverage this as kind of an opportunity to really create calmness during a very uncertain time for all of us and the world in general. We knew we had to think way outside the box when it came to how we were going to accomplish some of the opportunities that we had. And then we really wanted to focus on our doctors and our platform. One of the things that was very key for all of this is we did not want to outsource this solution to a third-party company like a lot of entities did, whether it be Teladoc, Amwell, or other solutions that were out there. And so to really kind of understand some of the components of how we made that happen, I really want to kind of talk a little bit about, kind of how we set ourselves up pre-pandemic for, achieving this opportunity. And one of the things that we had a very strong focus on for years is, kind of these three key points, and that's the patient, the physicians and our advanced providers, and the people. And in order to enable the proper performance, we had to basically start with the tools and infrastructure, understand the work processes, and make sure that we had competency in those tools, work processes. And that's really where we had change adoption. So for quite a while pre-pandemic, we really have been prepping the organization for this change adoption in really in a controlled fashion. And so what had happened during the pandemic, we actually took this really for a spin and kind of accelerated this very, very quickly, as you kind of saw from the video. And even kind of further dropping down a little bit from this, we actually had really set the organization up very, very well early on, because we knew that in order to gain the adoption and to gain change management, because look, healthcare is all about change management, new technologies come out, new processes come out, new regulations come out, and you continuously have to change. And where a lot of healthcare entities are always behind the curve when it comes to this, Millennium's always been ahead of it. And in order to stay ahead of it, we really needed to rethink how the organization was structured, specifically when it comes to how we rolled out technology and how we developed technology. And so the first thing is the people, which is our culture, our onboarding, our learning and development, our processes, whether it be optimization, performance coaching, our project management office, our digital services, and then you have the core technology, the information technology, information systems, clinical systems, cybersecurity, and digital systems. All of this actually resides under my division, and I'm responsible for all of this. And this actually gives us a lot of control and ability in rolling out these solutions. When we hit the telehealth, and when we got the kind of the word that we needed to kind of move very quickly, by having all of these three functions aligned, it allowed us to develop. So we went from a development cycle, a very, very quick development cycle, to the process understanding and optimization, to really the rollout through the people. And by focusing on these three areas allowed us to really heavily focus on getting this out to well over 500 physicians, well over 120 plus offices in really about a week is really what it took us from when we launched kind of that program. This is kind of where we kind of ended up with our platform. We call it MPG Connect. It's a fully integrated platform into the service, and it was not without its bumps and bruises for sure. Even though this is kind of where we ended up, this is not where we started. So to give a little bit of context, starting in 2017, we knew that telehealth was going to be part of this care continuum and this care cycle that we, were seeing coming down the pipeline. CMS was changing certain regulations, and as certain rules and value-based care and other things were coming down the pipeline, we had anticipated that we were going to be able to offer telemedicine and telehealth. And in our telemedicine application, not only were we working on the developing the video, the asynchronous video visit concept, but also things like remote patient monitoring, being able to give patients, devices at their home to look at, blood pressure, pulse ox, their weight, their exercise regimen, nutrition, those sort of things, but also like medication adherence. So we were building on all of this stuff for care management, mainly for our chronic condition patients and the patients that needed, really round the clock kind of care and monitoring to keep them healthy. So we knew that this was coming down the pipeline, and the application was designed with a lot of HIPAA regulations, a lot of rules, a lot of security components. So it really was an app that, they would have to log into. The original thought was that, a care manager would get the patient set up, get them logged in, and then they would be able to use the platform. So when COVID hit and we took a look at the platform, we realized that the platform was not in a scalable form to where we could really roll it out in mass. Even though we did roll it out, we recognized, based upon feedback from our patients, our providers, and even our team members, that we need to really change. We needed to change it very, very rapidly. Go away from the high secure system to really more of an easier system to use with still some security and other components in it, but really be able to make it a tool very similar to like Zoom or other systems that were out there, but was fully integrated with our EMR and other components that we had. So this kind of gives you kind of an idea of kind of how we really did this. So in March of—
Hey, Jeff.
Yeah, sorry, go ahead.
Sorry, just jumping in for a second. For anybody that's in the audience that doesn't know the lingo, EMR is electronic medical record.
Sorry, yes, electronic medical record. Thanks. Yeah, so the system, in March of 2020, we had a very secure integrated platform, and this integration would go with our electronic medical record, which is the patient basically chart. That's an electronic form. It was integrated with our online check-in. It was integrated with a lot of our online scheduling. So in the healthcare world, especially in primary care, it is very difficult to find a fully integrated, electronic health system that you can manage for your patients. So you typically have to get, what we call kind of add-ons or bolt-ons or other applications that are purpose-built. And so we had a lot of this in our ecosystem at the time. And so it was a very secure platform, required a username and password, a registration, a login, a whole bunch of other things. And so as we started down this path of evolution, it was web-based. So we had to very quickly roll out an app for the phone or the tablet. Then we had to relook at access through a computer, and each of these points are different versions of the software that we had to write. We had to make sure we had activation outside of the app, meaning that it was easy for somebody to use with a very simple click-through, activation to activate the video visit. We had to really relook at our website tools and how the web would actually integrate with this whole platform. Then in version number really 1.5, we got rid of the app. We said, we don't need an app anymore. Let's do this as an appless, lightweight application that really can facilitate these video visits that we needed to do. And right after that, an account was no longer required. And then we gave kind of birth, so to speak, to this, what we call the MPG Connect Express, which was a very simple, you get an appointment scheduled in our electronic medical record for your provider. You then get sent an email or a text with a secured link, and all you do is you click on that link and you're in the video visit. On the back end, the provider has all your medical information, all the information that's needed. They could invite others to the meeting if needed, or to the video visit. One of the things we saw is that we had patients down here. Their family members were very concerned with them, and they wanted to join the visit to make sure that their family members were being taken care of and were in good health during the pandemic. And then we moved from there to what we have today, and that's kind of our MPG Connect 2.0 platform, as we call it today. And so with that, I'll pause and see, Alex, if there's any questions. I know I kind of went through that pretty quick, but it kind of gives you a good idea of kind of the effort we went through.
Yeah, it certainly does. So we don't have any questions just yet. I have a question, and then if anybody does have any thoughts, if you want to put those in there. But so with all of these quick iterations and building out full native applications and then moving away from them. The question that I have, just looking at this and being part of the industry, is how did this impact the amount of technical debt that you were creating, and how did you handle that? Did you are you still going back and cleaning up some of that, or is it something that you were able to take care of through the process? And for anybody that is non-technical, the technical debt would be code that's written that's still a part of the application that is not used, potentially platforms or tools or frameworks that are in place that really need to be replaced very quickly for one reason or another. So Jeff, if you could answer that, and I'll keep an eye out for any additional questions.
Yeah, I think it's a great question. I mean, obviously, whenever you go through an agile process like this in a very short period of time, we're talking, less than, 30-day process, 9 versions, there is going to be some technical debt or some leftovers in the system. Our goal was to really not focus on that per se. It was really to focus on how do we get this platform and this system stable, scalable, and able to do thousands of visits per day, which is really what we wanted to do. So I really wasn't worried at the time about kind of cleaning up our legacy code. We did throw a lot of things out as we were as we're deconstructing the system. And there was a lot of opportunities we saw in that process. And to your point, right now we're kind of at this kind of crossroads where we know that we have a very good idea that number one, that telehealth is staying. Number two, what the telehealth is going to look like going forward. And so we actually are creating a whole new platform based upon all the lessons learned through these 30 days plus the year plus after that. To really get the application really kind of, would say, best in class and take our time really kind of designing it. So we're taking a lot of the code we learned, a lot of the application and technologies we learned, and we're pretty much doing a redo in really an accelerated fashion, and really recreating, and we're creating what we're calling the Millennium Connect, which is going to be more than just a telehealth or telemedicine application, but that's kind of what we're starting at. So we're actually creating a middleware component in healthcare that's going to help facilitate a lot more interoperability and connections with other healthcare systems and other things in the healthcare industry. So to answer your question is, there is a lot, but it's one that we knew we were going to have, and it was one that I was willing to accept to allow us to get to where we needed to get to.
Right. No, that makes a lot of sense. And actually, Tina asked a question while you were responding. We have a few questions coming in. So Tina's question: do you integrate with other healthcare systems? Do you send the medical records to the Snowbirds physicians back home? So if you want to take respond to that, and then I'll hit you with the next one from Stephanie.
Yeah, so I mean, that's a great question. And I think that is actually kind of even before the pandemic and before this process, we were doing that. One of the things is that our electronic medical record is extremely interoperable, and we do have the ability to send medical records and other things for Snowbirds, and our transient population that we have. So short answer to the question is yes. Long answer to the question is we are really looking at ways to really refine that and improve that. But yes, interoperability and data exchange is definitely something that we've had, and even SOMOR had. And what we did actually to even better facilitate kind of a secondary part to that question is this system would actually allow us to also plug in a care provider in another state or in another area to be also part of that visit. So it helped keep the continuity of care going. So if they had a specialist or if they had, another PCP up north, we could bring everybody together in kind of a group visit, so to speak, to where they can kind of see what the care is. And we saw that really allowed a good handoff of care between the different, areas of the healthcare sector.
That's a really great point, Jeff. So we have another question from Stephanie. So multi-part question. One, was there an analysis of existing platforms for telehealth rather than creating your own? Two, now that it is created, will you license it to other physician groups? And then you actually just answered the third part in your previous answer. So just 1 and 2 there.
What was the third one? Just for...
will it integrate with other platforms?
So yeah, so the answer to the question is, did we do an analysis of other platforms? Yes, we did. However, we had such a investment, time and effort and energy in the platform that we decided that we wanted to stay the course with our MPG Connect. We wanted to own the platform. We wanted our doctors to be able to use our platform. We didn't want to be holding anybody else. If you think about like Zoom, and a lot of providers jumped on the Zoom bandwagon, they had the security breaches and other things that happened. You look at like Doxy.me, which was another one that was out there that we looked at. It really wasn't fully integrated into our electronic medical record. So in regards to that, we made a very purposeful decision, both myself, our executive leadership, our medical executive leadership, that this was a path that we were going to go down in a very short period of time. We do not have plans at this point to license this to other physician groups or other entities. We're not in the commercial software business. We're really in the business to develop technology, tools, and processes for our providers, patients, and our team members. However, I do a lot of collaboration with other healthcare entities, other vendors, to help them as they kind of navigate through this and help them with kind of lessons learned that we've had. So we take more of a collaborative approach than more of a licensing approach. My philosophy is, we're not going to charge something, in the healthcare industry. We're going to help, the industry as much as we can.
Great. That's great, Jeff. Thank you for that. Just a quick side note before you start on. So Stephanie, that's Stephanie Gomez from Stabilized Steps. So another local entrepreneur that has her own startup in the healthcare space. So quick shout out to Stephanie. But yep, that's the end of our questions. So Jeff, if you want to continue on, appreciate it.
Yeah, and this is really this is my kind of last slide. So this is, really kind of focusing on kind of our core, philosophy and approach, right? As we develop any type of technology, and we've really got an integrated ecosystem. What I mean by ecosystem is, in the healthcare IT space, there are tens of thousands of software applications, technologies that do anything and everything under the sun, right? It's very difficult to kind of navigate, that area. So what we do is we really focus on what our patient caregiver needs are. We really try to understand what is the workflows that we're trying to do and introduce this, through careful change management and training. It kind of goes back up the other slide where we had that organizational alignment, which is really key for really any successful, technology initiative that we do. And then we validate it through analytics, incentives, other components to be able to help kind of gain, insight. And then we really look at the apps and core systems and make sure that they continuously are integrated, customized, and based upon feedback. One of the things that we were able to do early on in the pandemic is we were able to really get a lot of good feedback. Personally, had a lot of calls with patients, had a lot of calls with physicians, had a lot of calls with team members, to really understand what was their experience in the early days and the early versions of what we were putting out as far as, a product to our, to our end users and our customers who were the patients and the providers, and then really take that feedback and put it into our technical, widget and gadgets that we did, and had the guys really produce a very good, kind of deliver on product. And it really was fascinating to see how quickly we were able to move through that. And, it did amaze me how fast, the adoption was. And in fact, in April, when we went from about 3,000 in late March, we were doing about 3,000 in-office visits per day. That dropped right after the the safer at home order went into effect. That dropped to less than 500 in-office visits. And this is across the state of Florida. At the same time, telehealth actually was ramping up very, very quickly to where, the first week of April, over 75 to 80% of our visits were actually being done through the telehealth platform, even in its early infancy stages and not being where it needed to be. And that gave us a ton of feedback that we were able to put into the product very, very, very quickly. So that's kind of the Millennium story at a kind of high level of how we were able to get from basically zero to, well over, 250,000 visits on our platform for our patients through the pandemic.
Great. Thank you, Jeff. So thanks for that presentation. very, very helpful to understand kind of the process that you went through. I know I have a question for you, and kind of we'll go through this process again. And then if anybody else has questions or other areas you want to touch on, please feel free to throw those into the chat. But my question for you, Jeff, is more on the people change management side. So you talked about that in the very beginning of the presentation. You talked about how people and process is very important in workflow. So I'm, as I mentioned in the beginning of the presentation, I'm starting a role as a VP of Client Services with a cloud accounting company. And so one of the things that we're doing, it's a startup, and we've acquired some business. They have existing systems. We need to migrate off of those systems, streamline onto one CRM, all of those types of things. And I assume in this rollout, these are non-technical individuals that you're working with. How do you manage that process? How do you manage that process of getting the new tools out there, making sure that people are trained? How involved are you personally? Do you have a training team that's around that? I'd be really interested to understand how it works in healthcare, because obviously if you can't get the records into the system, it just brings you to a dead stop.
Yeah, so that's actually a great question. So I think, to answer the first part of the question, the change management from the people perspective, one of the key elements that I've learned is that, especially when you're dealing with providers, right? Providers are creatures of habit. They don't like things changing around them. So one of our goals was to especially in this arena, specifically when it came to telehealth and the fast rollout of the system, is we wanted to really keep our physicians in the system, in the platform they were familiar with, right? So in other words, the electronic medical record, the thing that they would do their day in. And what we wanted to do is we just wanted to make sure that they had one added component. So as opposed to the patient being in front of them in the room, they were in front of them on a computer screen. And the only real shift we had from the provider perspective delivering the care was really addressing the fact that it needed to be easy for them to get to the video, and then they would do their normal visit like they would with the patient in the room, except for they couldn't see, couldn't touch the patient, but they could do a lot of things with the patient through the video visit. If you go outside of the nuclei of the provider, and you look at let's say the front desk staff, right? Everybody's been to the doctor, you've got all this paperwork, all this stuff you got to do to check in, you got insurance card scanner, you got all this stuff, all this business stuff you've got to do to get checked in. We took that, we had already had a process to take that away and really have an electronic check-in component of it. So we were able to blend the electronic check-in component of it. So that way, even the front desk staff still had a system they were familiar with, which was their electronic medical record where they did their daily work. And then from the patient intake, which is now from the front desk, between the front desk and the provider, we needed to make sure that system was also kept intact. So the goal was to keep the existing system intact and only add on a new layer as far as workflow. And that new layer was this thing called video. That's why we didn't really go with other platforms that were not integrated, like the Zoom or the Doxy.me or other platforms, because it would have introduced too much change too quick, and it would have defocused them from kind of what we were trying to get them to do. When we do roll out technology systems and solutions outside of like a pandemic where we're in kind of extreme afterburner mode trying to get this stuff rolled out, I do have a learning and development team that does report under my division. They're performance trainers, they're content developers, there are a lot of other things that happen. We really evaluate and analyze what is the workflow, how's this workflow going to change, right? Because the workflow of getting a patient in, getting a patient seen, getting them checked out, and doing post-visit follow-up, it's all kind of, it's very linear. And we just need to make sure that the technology we're coming in is not too disruptive to that workflow, but we also give plenty of ample opportunity for feedback and documentation as we kind of go forward. So with the telehealth component of it, we kind of accelerated the technology, put it out there extremely fast, and then kind of went back behind and did these iterations based upon all the feedback we got. And so kind of a long-winded answer to your question, but that's kind of how we kind of view the change management with the people. We do have a thing called Millennium University that has been designed to be a repository for for all of our learning material and education material. We also have a system called the Millennium Cares Hub, which is like our lack of a better word, it's our company intranet that has all this data in it that we do strive very, very hard to keep up to date. And the other component of that is just continuously communicating what we're doing and why we're doing it, I think is extremely important.
Great, great. Thanks for that, Jeff.
And one last thing on that. The other key component of it is getting physician buy-in, right? We don't do anything without physician input, right? We've got a physician executive committee. I've got our chief medical information officer. So we really get them involved in the process of what we're doing. So that way, we kind of got that endorsement as we go out, and that kind of helps pave the way for this change, especially with the providers.
Got it. Makes sense. And so I have another question, so I'll just keep dominating if nobody else is going to jump in here. But so this is more of a future state question. So we're seeing all of these different technologies, augmented reality, virtual reality, are becoming more and more available in the home. And of course, telemedicine and this type of technology is becoming more and more adopted throughout. Where do you see things going next? How do you solve? Do you think that the systems are going to start to try to solve some of those those issues that you described of it is only video, so you can't touch, you can't feel, you can't smell. Where do you see it going over the next 10?
Well,
15 years?
I think and that's that's a crystal ball that I wish I had. However, I think that when you're talking about AI, you're talking about even the components of AI, machine learning, NLP, OCR, a lot of things that happen within even RPA, things that happen within AI. I think what you're going to see is you're going to see a fundamental shift in medicine in general. Now, this is just my hypothesis from what I've seen and from what I'm gathering. So I really think we need to understand what is the problem statement that's going to be solved for by using those type of technologies. So thus far, medicine has been really practiced based upon evidence-based medicine, meaning that you go to the doctor, you've got a cough, they then will look at, okay, what are the symptoms? What does this look like? And then they basically, based upon past evidence of what has happened, that's how they make their diagnosis. I think where we need to get to is we need to get into more of a predictive model for medicine. In other words, being able to take all this data, everything about you as a patient, and start putting some predictability into what your care condition might be like. So in other words, as opposed to looking from today back, let's look at today forward. And so with a patient that might might be pre-diabetic, might be borderline morbid obese and other health conditions, but they're right at that borderline where if they make certain changes now, they could potentially live a healthier life, as opposed to getting those after they've already contracted them and after they got the conditions. If we can figure out a way to leverage the technology to predict and give the patients a true sense of what it would look like as they go over the next several years, an example would be, okay, if you change your diet, if you start exercising, if you really pay attention to, your blood pressure, your stress, you relax, that sort of stuff, then your future will look like this versus like this, what it looks like. Because remember, we're always reacting in medicine based upon, the patient's issues or their conditions. Where technology is going to come into play is AI. Internet of Things is going to be a huge thing that's already starting to pipe up, where you're starting to see a lot of remote monitoring devices, whether it be Apple Watch, Fitbits, blood pressure, cuffs, those sort of things. So I think you're going to start seeing technology being leveraged to start crunching all this data and start really getting us into a predictive pattern of medicine versus its evidence-based pattern of medicine. So I don't think it's going to be any one technology or solution. I think it's going to be a bunch of things coming together. And that's really what I'm focused on is really understanding what are those bunch of things to get us into this kind of next phase. And you'll hear the term, like value-based, you'll hear the term, accountable care organizations. You'll hear a lot of different things in the healthcare industry, but it's all about keeping the patients healthy by being able to predict what their conditions are going to be based upon what the technology is telling us.
Makes a lot of sense. Thank you for that. We do have a question. We have another question from Tina. So I'll just read it directly. Is anyone developing new web cameras that integrate thermal imaging for taking temperatures, better lighted zoom images for looking at eyes, throats? Have you been approached by companies developing these kinds of hardware?
Actually, there are companies out there that are developing these types of technologies. Excuse me. There's actually one that actually uses a basic iPhone camera with the lifer on it to be able to take certain biomedical information like pulse, temperature, and some other things. So there are systems out there there are companies out there trying to use existing devices. And I also know of some that are actually creating their own devices that are going to be leveraged for that. And I think that there are a lot of devices that that are used for eyes, throat evaluation, even stethoscopes that patients can use to be able to monitor their heartbeat, so providers can listen to it. So yeah, there are companies out there, and I have been approached by them to look at what those systems are and what they can potentially do.
Got it. Cool. But wouldn't the problem with that then be that then you have to deliver those pieces of hardware to your patient and make sure that they're available? And some of these pieces of hardware, I'm sure, are not cheap.
I think that's kind of the age-old question, right? I mean, even with basic remote patient monitoring. I mean, if you were to put, so let's say if we were to give a patient an iPad, a blood pressure cuff, pulse ox, a scale, and let's say a stepometer, that setup alone could cost us $700-800 just for the initial setup, and then there would be a monthly fee associated with it. So these devices are still kind of expensive, but I think as the Internet of Things, as devices start to come out, especially with a company called iHealth, which I really like their devices because they really are starting to drive down the price. I think you're going to start seeing more adoption with that. Plus, also, it's on the reimbursement side. I think insurance companies and Medicare and others are going to start, reimbursing for those devices, so we can start getting them out there. Because I think, the way telehealth is going to stay in our world these days, I think really is going to be a matter of, okay, you see the doctor one time a year for your annual visit, your physical, whatever you need to see the doctor for, and then 2, 3, 4 times or on demand, you'll see your physician, based upon or via telehealth or telemedicine, and then what happens in between that is really what we're trying to solve for.
Great. Thank you for that. Jeff, this has been a great presentation. Absolutely appreciate your time. Since we do have a few minutes left, I want to ask you something that's a little different subject matter. So obviously you're here in Southwest Florida, and our mission is to connect technology and just to do everything that we can to diversify the economy, make this a welcoming place for either remote workers or companies that are relocating or startups forming. What do you see that Southwest Florida, that could really help Southwest Florida become, obviously not the next Silicon Valley, but become an attractive space for those types of individuals?
Well, I think it's offering up the opportunities, right? I think there's got to be a lot of opportunities for these high tech type concepts. And I know Southwest Florida has changed. Look, I've been in Southwest Florida, whether it be from Sarasota or Fort Myers, and I've been here since 2000, and I've seen this whole market from Sarasota to Naples, and it just completely change in regards to the tech area. I think the stigma of Fort Myers and even Southwest Florida being a tourist destination versus a living destination, I think is starting to change. Obviously, there always will be tourism and always be tourism focused, but I think there's a lot of companies that are coming in and looking at this as an opportunity. I think one of the challenges, I don't think people really know the amount of talent that's here. It surprises me when we look for a new position, just the amount of talent that we have in our workforce here, I think is really understated. And I think a lot of companies just don't know, the kind of talent that we have. I was actually surprised when we started doing our own development many years ago, how much that talent pool has actually started to increase. I think a lot of that has been because remote workers, especially post-pandemic, we've got a lot of remote workers in our market now that we could potentially nab up into our local companies here. But I think it's going to take time. It's going to take the opportunities. And I think people need to, it's kind of almost we're kind of reinventing kind of what, our market really is. We're a tourist destination, and that's huge, but we're also, extremely livable when it comes to those sort of opportunities. And there are, positions for technology and other service sectors out there.
Interesting. Great. Thanks, Jeff. Well, so we're coming to the end here. So once again, I want to thank you, but I do want to give you the opportunity to plug anything that you may have going on, any events, any organizational things, or if you're hiring for any roles, anything that you might want to put out there before we wrap up here.
Yeah, there was actually a slide that went missing, I just realized. But yeah, no, we definitely are always looking for talented team members to join our innovation services team. Like I said, we run the gamut from learning and development all the way to the high end, database architecture engineers. So if you check out our website at millenniumphysician.com and you click on the join us, if you know people that want to join us, we're always hiring. We're always looking to expand our team. We're growing just not only Southwest Florida, but all throughout Florida and probably through the Southeast United States. Over the next year or two, we're going to be expanding our footprint. So yeah, definitely take a look at our website if you know anybody that's interested in potentially joining a rapidly expanding organization that's really on the forefront of healthcare, both in technology and I think in innovation. So I do appreciate this opportunity, Alex, and everyone for your time and attention, and definitely appreciate it.
Great, thanks, Jeff. And we just got a little addition from Lisa, and always accepting new patients, of course, over at the Millennium Physician Group. So thanks for that update. Thank you so much, Jeff. This is going to be recorded, or this was recorded. This is going to be available on our website, so we'll be providing links to that. So if you know anybody that you think would benefit from any of this information, you will be able to link to it right from swfltech.org, probably in about 48 hours. So thank you thank you everyone so much for your time. And I hope that we see you all next week on Thursday with Neil Pennington presenting on